low carbohydrate diets have been found to impair artery function, worsen heart disease, and higher rates of all-cause mortality. Very low calorie diets and ketogenic diets have also been contraindicated in type 1 diabetics, kidney failure. So the question is which diet to follow.
Next, we have Dr. Sharmein Barmare. She runs the Silken Beauty Weight Loss Clinic in Bandra West, and thousands of patients contribute improved life to her. Let us hear her speak on tackling obesity and the right diet.
It's a pleasure and honor to talk about this topic, tackling obesity with the right diet, in front of this excellent crowd. What is obesity? It is defined as a chronic, relapsing and treatable multifactorial neurobehavioral disease wherein an increase in body fat promotes adipose tissue dysfunction, resulting in adverse metabolic, biochemical and psychosocial health consequences. So, over 1 billion people around the world are considered overweight and obese, and since 1975, according to WHO and the Centers for Disease Control, the rates have tripled worldwide. So in 2020, the numbers were around 2,603 million, whereas in 2035, it's going to be double. We are not far behind in obesity. 35 million are already there with obesity in India, 38.4% men and 36.2% women. Also, we have the Asian Indian phenotype. We are referred to as thin fat Indians because we have a greater fat mass percentage, both total and abdominal, with less lean mass. And because of this ethnic predilection, non-communicable diseases occur almost 10 years earlier in Asian Indians compared to the Western counterpart. So, what is the criteria for overweight and obesity in Indians? Body mass index of greater than 23 is considered overweight, greater than 25 is considered obese, waist circumference greater than 90 cm in men and greater than 80 cm in women, waist hip ratio 0.9 in men and 0.8 in women, and a body fat percentage greater than 25% in men and 30% in women. So, what are the factors contributing to obesity? So, it's multifactorial, right from genetics and epigenetics. Our lifestyle and dietary habits influence epigenetics. Lack of sleep, less sleep leads to decrease in the leptin levels, which is your satiety hormone, and increase in the ghrelin levels, your hunger hormone, and it leaves you hungry. There's an altered gut microbiome. The built environment is the obesogenic environment. We are surrounded by a lot of food, energy-dense food, lack of physical activity, sedentary lifestyle. Stress is another factor contributing to obesity. Socioeconomic causes, lack of education, lack of affordability for healthy food. There are certain medications like antidepressants, antipsychotics, glucocorticoids. Some are hormonal causes like hypothyroidism, PCOS, menopause. The increase in obesity has led to increase in associated comorbidities like type 2 diabetes mellitus. There is cardiovascular disease, hypertension, obstructive sleep apnea, osteoarthritis, gallstones, cancer, and social stigma. Being overweight and obese increases chances of having hypertension by 65 to 78%, pre-diabetes by 14.3%, diabetes by 30%, cancer around 4 to 8%, and coronary heart disease 28%. So based on the BMI and obesity staging, comprehensive lifestyle interventions, which includes diet, physical activity, and behavioral therapy, they are recommended as initial therapy and also for all the stages of obesity. So what is the target of weight loss required for improvement of metabolic parameters and remission of diseases? In type 2 diabetes mellitus, a 5 to 15% weight loss leads to reduction in the HbA1c levels, reduction in drugs, and remission of diabetes. In metabolic syndrome, 7 to 10% leads to prevention of diabetes. In NAFLD, a 7 to 10% weight loss results in reduction in hepatocyte fat and NASH resolution. In PCOS, a 5 to 15% reduction lead to improvement in the ovulation, reduction in insulin resistance, and hirsutism. In dyslipidemia, a 5 to 15% leads to reduction in triglycerides and LDL and rise in HDL. In hypertension, a 5 to 15% weight loss will lead to lower blood pressure and decreased medication. And sleep apnea, a 7 to 11% weight loss leads to decrease in apnea and hypopnea index. So depending on the amount of food taken, we have the low calorie diet where there is a consumption of 1000 to 1500 calories, very low calorie diet, consumption of 600 to 900 calories per day, and there are meal replacements given where people who don't want to take an effort for calorie calculation or meal planning. Then depending on the type of food taken, we have the low fat diet where consumption of fat is less than 15 to 20% and saturated fat intake is less than 7 to 10%. It's mostly plant-based meals. There is low carbohydrate diet. Consumption of carbohydrates is less than 45%, like around less than 130 grams per day. So with the various diets used for weight loss, scientific evidence has shown that with reduction in weight, there's improvement in the metabolic parameters like the lipid profile, blood glucose, blood pressure. But low carbohydrate diets have been found to impair artery function, worsen heart disease, and higher rates of all-cause mortality. Also, there is increased rates of constipation, headache, halitosis, muscle cramps, general weakness. Very low calorie diets and ketogenic diets, they have increased mood changes, and also the very low calorie diets and ketogenic diets have also been contraindicated in type 1 diabetics, kidney failure, cardiac arrhythmias, and in older patients with frailty and in pregnancy. And overall, it is very difficult to adhere to it for a long time. High protein diets from animal sources have to be used in caution in chronic kidney disease. So the question is which diet to follow. So which is the right diet? A diet which is safe, simple, sustainable, economical, gives satiety, gives significant weight loss and a weight maintenance over a period of time, is also evidence-based, and it results in reversal of chronic diseases like heart diseases, diabetes, hypertension. So the scientific evidence points out that a whole food plant-based diet achieves greater weight loss compared with any other dietary intervention. It is safe, simple, sustainable solution to the obesity epidemic. A whole food plant-based nutrition encourages people to eat ad libitum without counting calories or controlling portion sizes. The strategy is to improve the quality of food rather than reducing the quantity. Whole food plant-based diet is the only diet shown to reverse heart disease and also has been found to help treat, arrest, and achieve remission of other chronic diseases such as type 2 diabetes mellitus and hypertension. So what is a whole food plant-based diet? This diet consists mostly of food from plants like whole grains, vegetables, fruits, beans, and legumes, nuts, and seeds. And it contains no animal products like dairy, meat, and eggs. It focuses on minimally processed foods that are in their natural state. So, whole grains, pulses, vegetables, they are source of complex carbohydrates. They have fiber and natural sugars. Fiber is good for the gut and immune function. The naturally occurring sugars and complex carbohydrates, they are healthy and they are consistently associated with lower rates of chronic diseases. Often people consider plant proteins as incomplete and they feel that it can be derived only from animal source. But that is not the case. Plant proteins contain all 20 amino acids, including the 9 indispensable amino acids. Soybeans, buckwheat, and quinoa are the most complete proteins. Fruits and vegetables are a good source of fiber, micronutrients, polyphenols, and antioxidants. Fats are recommended mostly from natural sources like nuts and seeds, and saturated fats like ghee, vanaspati, butter, coconut oil, they need to be replaced by monounsaturated fats and polyunsaturated fats. What are processed foods? Processed foods refer to any foods that are changed from its natural state. Processed food have added preservative, nutrients, flavors, color, salts, sugar, and fat. The food manufacturers, they formulate the food in such a way so that it makes us craving more for these kinds of foods. It's an optimal combination of sugar, fat, and salt. So, how does a whole food plant-based diet mechanism work in obesity management? First, it promotes satiety. So, whole food plant-based foods, they are low in calorie density, they are low in fat, they are high in water and high in fiber. So, fiber-filled foods require greater mastication, which reduces the ingestion rate, increases the stomach distension, and promotes satiety. Thus, eating high fiber foods makes it possible to fill up on fewer calories without experiencing hunger. This is a key element for weight loss. Fiber is only found in plant foods and it is an essential component of healthy eating pattern, as high fiber consumption is overall associated with lower chronic diseases. And high fiber consumption is a hallmark of plant-based diets. Thermal effect of food is defined as the increase in metabolism after the intake of meal. A greater presence of complex carbohydrate and lesser presence of fat, like in a plant-based diet, it is associated with postprandial activation of the sympathetic nervous system with an increase of energy consumption. Gut microbiota. On a whole food plant-based diet, the fiber functions on the microbiota accessible carbohydrates, also known as prebiotics. So, our good gut flora eats fiber. Symbiotically, we feed fiber to our good bacteria, which in turn makes short-chain fatty acids. They get absorbed in the bloodstream, circulate throughout the body, and reach the brain. In this way, the gut flora sends satiety signal, reducing the appetite, increasing the lipolysis, and increasing the metabolic rate. Also, in obesity, there is gut dysbiosis, there is increase in the intestinal permeability, and there are an increase in inflammatory cytokines. So the plant-based diets also protect the intestinal barrier integrity, thereby reducing inflammation. Obesity is associated with insulin resistance and type 2 diabetes, especially in Indians, because our diets are rich in high carbohydrates and saturated fats that leads to increase in insulin resistance. Whole food plant-based diet which have low fat and high fiber and carbs with low glycemic index, it increases the insulin sensitivity with lesser risk of obesity and type 2 diabetes mellitus. Then plant-based diets that minimize saturated fat and simple sugar intake may also lead to an increase of leptin sensitivity, which at the same time leads to an increase in insulin sensitivity and favors lipid metabolism. One should understand the concept of what is calorie density. Calorie density is the number of calories in a given volume of food. Certain foods have more calories packed in them. So for the same volume, some foods have more calories, like per cup, per kg, per grams, per mouthful than others. For example, 400 calories of fruits and vegetables, they fill up your stomach entirely. Whereas 400 calories of oil, it hardly fills up the stomach. So the oil is having high calorie density, and fruits and vegetables are low calorie density. Similarly, beans, grains and potatoes also fill up your stomach. They are low calorie density, whereas animal products and dairy products like cheese, they hardly fill up your stomach. So they are high calorie density. Average human stomach capacity is around 0.5 liters, but it can fit a liter of food. So when a threshold volume is reached, the stretch receptors in stomach, they send a signal of fullness to the appetite regulation centers in the brain. Traditional diets, they focus on decreasing the portion size, eat less approach, but that leaves individuals feeling hungry and unsatisfied. So the emphasis should be to eat more healthy, low calorie density foods, which provide satiety. So what are the physiological impacts of whole food plant-based diet on obesity? It improves your insulin sensitivity independent of weight loss, lowers the total caloric intake and improves satiety, changes the epigenetics, lowers the overall endothelial cell injury, oxidative stress, and the inflammatory cascades, lowers the inflammation through addition of antioxidant foods, reduction of pro-inflammatory foods. It normalizes angiogenesis, reducing comorbid disease, cancer and heart disease, improves the HbA1c and normalization and sensitization of leptin and adenopectin levels, improves the gut health, helps in overcoming food addiction and dependency, by helping to reprogram the taste buds and break eating patterns. The phytochemicals from plants help to normalize the dopamine reward system in the brain. It reduces the cost of medical treatments and hospitalization. It's sustainable, can eat abundant food without caloric restriction. This article is from the Journal of Lifestyle Medicine, American Journal of Lifestyle Medicine, 2020. A large cross-sectional study carried out in Slovenia, which examined the short, medium and long term from 0.5 to 10 years effect of whole food plant-based lifestyle program on obesity indices, the body mass index, the weight and body fat percentage. The results of this study was that the beneficial effects of whole food plant-based lifestyle was achieved in first 2 years, and it was successfully maintained in the long term 5 to 10 years. Participants experienced a mean BMI reduction of minus 2.5 kg per meter square, weight loss of 7.1 kg, and body fat percentage reduction was 6.4%. And it was also discovered the participants were passing on the healthy and active lifestyle to the next generation. This is another trial, a broad trial, a randomized control trial using whole food plant-based diet and its effect on BMI and cholesterol. A community-based program in New Zealand. Participants were diagnosed with obesity and overweight and having at least one of the comorbidities like type 2 diabetes mellitus, ischemic heart disease, hypertension or hypercholesterolemia. The trial was for 6 months but subsequently extended. Conclusion. In patients who are interested in dietary changes, whole food plant-based diet can be offered as a safe and effective option for losing weight and obtaining some reduction in cholesterol without necessarily increasing exercise. The main advantage is eating to satiation without restricting the amount of food eaten. It showed several improvements in chronic disease risk factors and quality of life, which was maintained for 12 months. The participants who are on the whole food plant-based diet, by the end of 3 months, they lost around 19 lbs, and by the end of 6 months, they were down by 27 lbs. And at the end of 1 year, they did not gain weight as seen with other diets. This is another article, a review article, which was published in American Journal of Lifestyle Medicine by Dr. Michael Greger, in which he explains about the benefits, mechanism of action of whole food plant-based diet and its evidence. So what he concludes is what appears to be the most effective weight loss diet is the only diet shown to reverse heart disease in the majority of patients. If reversing the number one killer of men and women was all a plant-based diet could do, shouldn't it be considered the default diet until proven otherwise? Furthermore, it can help in treating, arresting and reversing other lifestyle diseases like type 2 diabetes mellitus and high blood pressure, making the case for plant-based eating simply overwhelming. There are some foods that enhance weight loss: apple cider vinegar, black cumin, regular cumin, ginger, garlic, spinach, kale, curcumin. To summarize, a whole food plant-based diet is a safe, simple, sustainable solution for the obesity epidemic. It has low calorie density, high water content, protein source and high fiber components. These significantly influence the effectiveness of whole food plant-based diet for weight loss. It achieves greater weight loss compared with any other dietary intervention. It has been shown to reverse heart disease and help treat, arrest and reverse other chronic diseases like type 2 diabetes, hypertension. Globally, populations that traditionally consume large whole food plant-based diets are where we find the longest expected average lifespans, as demonstrated by the regions dubbed as blue zones. Whole food plant-based diet, they increase longevity and reduce mortality. They are environmental friendly. They reduce the greenhouse gas emissions, water consumption and land use for factory farming. These are all factors in global warming and environmental degradation. Combining whole food plant-based diet along with other lifestyle interventions like exercise, adequate sleep, stress reduction, addressing psychosocial factors, avoidance of risky substances, it will help achieve maximal weight loss. Thank you for a patient hearing.